see. Let's talk a little bit about ozone. Dr. Tinney, he's a huge fan of ozone, and we're hopefully going to get one of these machines soon. Now, what are some of the uses of this ozone?
Well, it's great for oxidative stress. It helps with hyperoxygenation, vascular inflammation, helps with viral infections, autoimmune disorders.
Cancer as well,
kind of chronic infection. You know, cancer treatments.
Mycotoxins, fungi, everything.
I was reading some of the.
So when you said for oxidative stress, but it's actually oxidating, right? Because it's giving an extra.
Right, exactly. Oxygen. I think more of a free radical kind of.
Correct. And we're going to talk about a couple of these therapeutics. We're going to talk about hyperbaric, chlorine dioxide, and then even hydrogen peroxide. All of these are oxidative therapies, every one of those. And so there seems to be a very powerful mechanism there for treating these chronic stealth infections.
Because they're anaerobic, most of them.
Yeah, right. They don't like oxygen.
Right.
But that also means that we can't.
No, go ahead. Sorry.
No, just so that also means though that we can't use it too often because we're going to be inducing more oxidative stress in our own body, in our own tissues as a consequence, right? So it's kind of a balance where you want to try and target these things, but because I know some people kind of just like to do it, almost like preventively, but I'm not sure about the rationale of that. You know what I mean?
Yeah. I mean, I've done it a few times, and it makes me feel like I just went diving. It's a weird effect. It's almost like you had had been breathing compressed air for a while. I get sleepy. I just want to take a nap, but then like the next day, I feel amazing. So I don't feel like it's an immediate reaction, but I think it can be useful. Of course, oxygen's the terminal electron acceptor in the phosphorylation cascade. So you're, improving mitochondrial function, I think, as well.
Yeah, I wonder if this fits in with the concept of hormesis, where you are inducing a little bit of a controlled dose of stressor in the body, not a easy stress where you're totally out of control and your sympathetic is completely haywire, right? But you are inducing something that's controlled, that's measured, that's timed, etc., but that you keep your body on its toes and becomes more resilient. Do you guys think that may be part of how it works as well?
I mean, it's a logical conclusion. Yeah, I would say there's an argument for that for sure.
Yeah, I think so.
At the Holistic Biospa in Puerto Vallarta, we have a 10-pass ozone machine where it actually pressurizes the blood. And after 5 treatments, people usually do not have Lyme disease, but it's really hard to diagnose if you have Lyme disease or not. So ozone works every day. Then you can always give vitamin C IV afterwards, because I talked to my friend David Brownstein. He says give ozone first before vitamin C, because the vitamin C will help regenerate the glutathione.
Yeah. Yeah, we actually do that.
What's the dose of
back it in.
Sorry, I was asking what the dose is as far as like not causing an alkalosis in the bloodstream, because at that point I feel like you're less likely to offload to the tissues if you're disrupting the oxygen hemoglobin dissociation curve.
Are you talking about the ozone?
I haven't checked the venous pH. I haven't checked the venous pH. I don't know.
Okay.
But I know that 10-pass ozone works really well.
10 pass. What does that mean, 10 pass?
It goes through the blood 10 times, and the blood is pressurized with ozone. So it really hits the organisms pretty well. And usually only after 5 treatments, supposedly people are cured of their Lyme disease, but who knows?
So on that, when it does a 10 pass, is it extracting anything, or just hitting the blood and then recirculating it through the body. So it still has to detox those, whatever it's killing off.
It's taking blood out, pressurizing the blood with ozone, putting it back in. So yeah, there probably is stress, but it's killing the organisms really quickly.
Right. But then the body is still responsible for eliminating the toxins that are killed.
Of course, even cancer cells, of course.
Yeah. So most of these people have poor detox pathways. So you start killing off things rapidly and they can't excrete them, then they start feeling worse.
You're right. You're right.
That makes sense. I've heard that before with patients.
Yeah.
Yeah, the
So-
protocols we have for the ozone start out at like a low dose, and then each time you get it, you get a higher concentration of ozone. So
Makes sense.
until you hit kind of a max after, I think, the 5th treatment.
Kind of boiled the frog kind of thing.
Yeah, right. Yeah.
Yeah.
And then we run it through a UVB filter also. We have some glass filters. I think they just kind of make the blood, spiral through this glass tubing as it goes through this UVB light. So
Fantastic. So excited to start doing this at the office.
So how cost effective is that? What do the treatments typically run?
well, you can charge different prices for them. The setup is about $10,000, $12,000 right in there. And then if you're going to continue using the glass tubing, those run about 75, and they're single use patient units. But I think we can sort of get the same effect by just taking the IV tubing and kind of meandering it back and forth inside the UVB light rather than slowing it down through tubing. Yeah, we charge generally around $300 for a treatment.
Per treatment.
Yeah. And then I think we're probably going to give a discount with people that are members in our practice. So we're thinking more like $250 or so.
Mhm.
But your cost, if you're not using the filter, is pretty cost effective once you pay for the unit. You're just using some saline and a little bit of heparin and some oxygen to make your ozone. That's about it.
Yeah.
On the ozone book, that doctor recommends using D5W instead of saline because he says the ozone can react with the chlorine.
Oh, really? Okay.
But anyway, rectal ozone is really cheap, and you can do that for 5 minutes once a day, and patients can buy their own ozone machine and just do rectal ozone.
Yeah, we can.
Is it still about $10,000 for a home ozone
No,
machine?
it's a lot cheaper than that. A lot cheaper than that, but I don't know the price right now.
Yeah.
Rectal ozone.
But I've done rectal ozone on me before. Being a doctor, you can't call in sick, so after 5 minutes, I could actually make it to work. So at lunchtime, I felt pretty good. So rectal ozone is not bad. Okay.
What about nasal? Isn't there a nasal?
Yeah, but you got to hold your breath because you don't want to get ozone inside your lungs.
So rectal. Yeah.
What about injectable? I had a patient tell me a functional doctor gave her an injection of ozone into her hip. It helped her pain in her hip. You heard of that?
That's okay, but you don't want to do IV because if you get any oxygen in there, you can kill the patient.
Oh yeah, but into like a burster or something. I don't know if you guys.
I've not heard of that.
Yeah.
I'm trying to avoid any subcutaneous emphysema kind of thing.
Yeah. We go with a peptide IM.
Yeah, right.
Yeah. That's way better. All right,
Yeah.
cool.